Good evening. Welcome everyone to the post-lunch and probably the last session of today. Let's know all about ophthalmologist operation theater, infection control practices and protocols. Myself, Dr.Gitumoni Sharma, who being born in a remote Lohit district of Arunachal Pradesh, many of you probably have not heard of it. That's beyond the Dhola Khodia bridge, recently inaugurated by our Prime Minister in Assam over Brahmaputra, and having started my medical career in Assam, and then traveled over almost everywhere in India, and now a vitreoretinal consultant based in Raipur, Chhattisgarh, must thank All India Ophthalmological Congress 2018 for accepting my instruction course. May I call upon the other instructors of this instruction course, whom you will listen to in the next 60 minutes. First, Dr. Deepshikha Agrawal, Director, MGMI Institute, Raipur, who is, besides other feathers in her cap, is the recipient of PBMS HV Desai Eye Hospital Golden Eye Coin Award in 2015 for her dedicated 25 years of quality eye service, and also Distinguished Service Award by APAO in Taiwan in 2016. And I must thank you, madam, who has given me the platform I wanted to work in the beginning. May I call you up into the dais, ma'am? Please be seated. All India Institute of Medical Science, New Delhi, and a DNB and a trained vitreoretinal surgeon from Sydney Eye Hospital, Australia, now an accomplished vitreoretinal surgeon, and most important is my mentor and a very good singer too, probably many of you do not know. May I call upon the dais Dr. Harsha Bhattacharjee sir, Medical Director and Founder and Trustee of Sri Shankardev Netralaya, Guwahati, of which I am a passed out. It is said that ophthalmology in the northeastern part of India follows wherever sir steps into. Amongst many awards recently, he is the Eye Health Hero of IABP conferred upon him. He is also my mentor. I thank both of you for accepting to speak for my instruction course, and madam also. This instruction course is my Guru Dakshina for both of you. Next, would like to call Dr. Samrat Chatterjee, Cornea and Anterior Segment Consultant, MGMI Hospital, Raipur, whose name is recently recipient of 2 AIOS awards and Orbis Award in EACRS. May I call upon here to come to the dais, please. Next, may I call upon Dr. Sagarmoy Purkasta, Comprehensive and Glaucoma Consultant of MGMI Hospital, Raipur, to speak on sterilization, which is a very important part of this instruction course. So we'll be talking about the topic of ophthalmic operation theater layout and design, ideal ophthalmic operation theater, instrument cleaning and sterilization, microbiological surveillance of operation theater, OT etiquette for everyone inside OT to keep one out of trouble. Did I change my OT while acquiring NABH accreditation? So these are the important topics which we will be discussing in the next few minutes. In any healthcare setting, including ophthalmology, the cornerstone of clinical practice is asepsis and antisepsis. This aspect of ophthalmology, though very important, but less talked about in day-to-day practices, and thereby the aspect of learning the infection control practices and protocols pertaining to ophthalmic practices is less. So lack of knowledge or negligence in infection or standard practices would result in hazardous effects, as sterile instruments and environment are essential for successful eye care services. HAIs are, though minimal in ophthalmic practices, because the patients stay in the hospital rarely exceeding 48 hours, but these are epidemiologically more associated with certain patient care procedures, for example, transmission of HIV through tears, etc. So providing a standard and safe surgical procedures emphasizing the modern aseptic techniques and infection control practices pertaining to ophthalmic operation theater is discussed in this instruction course. And this is also been taken because nowadays quality assurance, rules and regulations by the bodies, and medical tourism, these are the new sectors which are coming up to the hospital sectors. My topic is ophthalmic operation theater layout and design. It's my privilege that I have been working in the most beautifully crafted ophthalmic operation theaters of the country and been corrected by my learned teachers while learning to do surgeries in this OT. As I can see in the picture, it has been shown in the picture here. The operation theater is a technically therapeutic aid where is the pointer? Where all these personnels work together for the ultimate aim of caring of the patient. The operation theater should further be similar in design and character to make it easy for all surgeons and nurses to use them without the necessity of familiarizing themselves every time with a new set of conditions. So it dates back to 1822 in London. This is one of the oldest operation theater mentioned. On an average, operation theater caters to 50% of the needs of total healthcare seekers. Anesthesia control time typically represents a small fraction of the total case time, the remainder being surgeon and nurse control. This unit needs constant specialized services such as pipe, suction, and medical gases, electric and water supply, heating and air conditioning, ventilation, and lift services. There are many different ways to build an OT complex. When involved in the build of a new complex, it is advised that the building team visit as many other complexes as possible to determine what works and what does not work. So it is a good idea to consult everyone involved in building facilities in the past, as they will have a lot of useful suggestions on what to do and what not to do, and we can learn from their experiences. The more people involved in design from a wide group of experts, then the better the facility will be. This includes consulting senior and junior nurses, doctors, administrators, cleaners, and even builders. Everyone works in the facility and everyone will have valuable suggestions to share about their work area. This information is vital and will help the core design team ensure as many ideas as possible are considered within the budget and space constraint. So it's all a combo effort. The purpose is to offer a supply and installation of sterile environment system and clean room infrastructure for operation theater. The aim is to provide patient safety, infection control, and increase surgeons' confidence. The principle is to which is to be taken into consideration while planning an OT are: first, we'll have a talk about the location of the operation theater. It should be in a quiet environment, freedom from noise and other disturbances, freedom from contamination and cross-infection, maximum protection from solar radiation, convenient relationship to other departments, low-rise buildings limited to 2 or 3 stories high are preferred because of maximum advantage of natural light and ventilation as approximate can be derived, lift in casualties. Now next comes after the location, next comes the zoning. A high degree of asepsis should be ensured to provide appropriate environment for patient and staff. Zoning should be done to keep the OT complex free from microorganisms by avoiding crisscross movements of men and machines. Provisions for emergency exit has to be there, provision for ventilation and temperature control, keeping in mind the need for laminar flow, HEPA filter, air conditioner, etc. should be there, and there should be adequate and appropriate space allotted as per utility of the area. Now third is the suggested layout. The suggested layout as per the AIO's guideline is we should have an outer zone which is the reception area, clean zone which is the changing area, room and transfer zone, aseptic zone which is the scrubbing, gowning, gloving and the operation room itself, then the autoclave room and the disposal zone. Now the protective area has all these components which includes change rooms for all medical and paramedical staff, then there is a transfer bay, rooms for administrative staff, stores and records, and the other adjacent rooms. The next is the clean zone which connects the protective zone to aseptic zone and has other areas also like stores and cleaner, equipment storeroom, maintenance workshop, a pantry may be there, firefighting device room, emergency exits, service room for staff, closed CCTV control area. The aseptic zone, which is the most important zone, is the sterile zone. There are 3 main categories of operation theater one can build. It's a single theater suite, next is a twin theater suite, and third one is the OT complexes of 3 or more suites. So the first one has a scrub up and gowning, anesthesia room, trolley, preparation, utility and exit bay, plus staff change and limited ancillary accommodation. So this is the sterile area. E is the sterile area with one operation theater along with the other zones being described, shown here. And the next is this is the NPCB guidelines of a 10-bedded ward having a sterile OT of one sterile OT, provision for one sterile OT, and here 2525 square feet is the area which has been shown. This is the second category of OR, which is having 2 surgical spaces along with a sterile storeroom option also there shown. And this is the third category OT, where we are having OT1, OT2 and OT3 along with the sterile corridor here shown. The place where I work is a multi-operation theater area. This is the operation theater area of MGMI Institute being shown with a dirty corridor this side and exit through this area. And these are the all adjacent area being shown here. This is the 3D picture of the same thing which I had described before. The dirty corridor is here back, and these are the OT which are being shown in. Here is the CSSD area, and again here these are the OT area along with the changing room and etc. in this area. So NABH guidelines tells that the OT standard size should be 20 by 20 by 10 feet. It's a standard of NABH. The occupancy should be 5 to 8 persons at any given point. Equipment load should be 5 to 7 kW considered per OT, and ambient temperature and humidity. There are standards. If you want to go, can read the NABH guidelines. For the general OT, that is where comes the ophthalmologic OT, air change per hour, air velocity, positive pressure, everything has been described. Then air handling in the OT, including air quantity, temperature and humidity, air filtration. Next comes the concept of a modular OT. It's an option, but it's better to have a modular OT. This is a new concept which is coming up, which is a continuous flow of highly filtered bacteria-free air, which is reticulated under positive pressure into the operating field, and air contaminants generated during surgery are removed from the site. So the concept itself of a modular OT is to make it a sterile bacteria-free environment. There are specifications for wall, ceiling, and slanted panels. So everything is available: operating list board, OT flooring, anti-static conductive tiles, hatchbox are there, view windows with blinds, pressure relief dampers, air and light, OT equipment, hermetically sealed sliding doors, storage unit, and surgical scrap. You will get to know about all these things in the next, when my next speakers will talk. So the walls, they say it's a puff sandwich panel. Different companies have different kind of specifications for how they make the walls. So you should look for a puff sandwich panel. They say it is better. So all the specifications are there. As per your requirements, you can talk to the companies and then decide which one do you need. Air and light, then modular OT equipments, hermetically sealed door, modular OT storage units, surgical scrub stations, and the sub areas, which includes all whatever is shown here, excluding the operation room. Next is the theater sterile supply unit, which has the specifications for temperature and air conditioning. This is a layout of a central sterile supply unit. So the statutory regulations which are important during the design and planning of an OT complex will need compliance with the mandatory regulations related to local administrations such as municipal corporation, government, pollution control board, fire safety department, water supply and drainage department, etc. So in the present era of evidence-based medicine, it becomes imperative to give maximum importance to planning an operation theater complex. Within the limitations of finance and space, the best results can be obtained. An anesthesiologist with multiple roles inside the operation theater complex should be consulted in the process. Efforts should be made to conform to the standards laid down by the local bodies and international agencies, as healthcare facilities in India are now catering to. more and more international clientele. However, new OTs and hospitals that are being established cannot be expected to fulfill all theoretical requirements as new ideas are constantly being developed. So ultimate is the patient's safety first. Thank you for your patient hearing. May I call upon my next speaker? Ideal ophthalmic operation theater, Dr. Dipshikha Agarwal. The third one will take up now. Yes, ma'am, please.
Good evening, everyone. I am thankful to Dr. Gitumoni and Scientific Committee of AIOC giving me this opportunity. I will be talking on ideal ophthalmic operation theatre. So, why the need of ideal ophthalmic operation theatre? Because surgical care is an integral part of eye care system, and ophthalmitis is the most devastating complication of any ocular surgery. Surgical site infections are the second most common cause of hospital-acquired infection. Every step should be taken to reduce any devastating complications of surgery. So if we see the evolution of operation theatre has evolved from a simple room with minor equipments to a packed theatre and eventually to the sterile and special environment of modern operating theatres. It is from 18th century to 19th century. And this is a consequence of acceptance of germ theory of disease that was theorized in mid-16th century and validated in late 19th century. If we see in ocular surgery, historical perspective and creation of concepts, cataract surgery was started in houses by couching, then camp surgeries in schools, dharmshala, community halls, primary and community health centers, other venues like train, plane, van and ship. So then what is the ideal operation theatre? An ideal operation theatre is an environment in which all sources of pollution and microenvironmental alterations are kept strictly under control. Fundamental principle is no harm to the patient and surgeon. Standard operation theatre protocol should be maintained, and operation theatre should be customized according to the size of hospital, patient's turnover, available resources and future need. This is very important for any ideal operation theatre. Ideal operation theatre includes location of operation theatre, design, environment of operation theatre, equipments and instruments, CSSD, other supplies, traffic in operation theatre, dress code, maintenance, OR surveillance, OR biohazardous waste disposable, safety measures, handling of emergency, and proper ongoing training of staff. Design and location is very well covered by my Dr. Gitumoni. So low-rise building and OT should be separated from general traffic and air movements of rest of the hospital. Space of OT should be accommodate the needed equipment and staff. OT should be of minimum size of 250 square feet. For general anesthesia patient like pediatric, retina and oculoplasty, size should be of 400 square feet. To accommodate anesthesia machine, equipment, lighting and other monitoring equipment, size should be 576 square feet. Door should be adequate width of 1.2 to 1.5 millimeter, sliding and a small window on the door. Surface should be silk resistant with minimum joints, seamless wall and washable paint. Pendants are for pipeline services like oxygen, nitrous oxide, medical vacuum, compressed air and electric sockets. Lighting, ceiling mounted lamps, illumination of at least 500 lux with minimal glare. UPS should be available of adequate capacity for OT, light, microscope, machines, monitors, anesthesia machine and until generator backup takes cover. Audiovisual system in OT is also very important for recording of surgery, demonstration and teaching. Scrub sink for 2 to 3%, water should be filtered, tap should be hand, foot or sensor operated, height of tap should be 10 centimeter above the wash basin, adequate and continuous water supply in operation theatre. Ventilation and temperature maintains the environment of operation theatre. It is very important. During surgical procedures, dust particles, textile fiber, skin scales and respiratory areas are loaded with viable microorganisms are released from surgical team in OT. Risk of infection is significant with the aerobic bacterial counts in the range of 700 to 1800 bacterial carrying particles, but it is insignificant when count is 180 per cubic per meter. High quality